welcome. I am Claudine Close, the president of Historic Red Hook, and it's always a pleasure to collaborate with the Rhinebeck Historical Society. The president of the Rhinebeck Historical Society is behind the camera, and it's a special privilege to work with Northern Dutchess Hospital. We haven't done that before. It's very exciting, and I want to make a special thanks to the Thompson Trust for providing the refreshments today, and to the hospital for allowing us use of this room. So I'm pleased to welcome our speaker today, Dr. Sandra Lewinson from Pace University. She is a professor of nursing and one of the very few people in the country who study the history of nursing. She has received many awards, among them the Outstanding Scholarship and Research Award from Columbia University Teachers College, another from the American Association for the History of Nursing for her work, Taking Charge, Nursing, Suffrage, and Feminism in America, 1873 to 1920. We first heard of Dr. Lewinson last summer when she contacted us at Historic Red Hook, asking if we knew anything about an early 20th century visiting nursing service in Red Hook, and in particular about a woman named Mary Gerard Lewis. We were stumped. We had no idea. We knew nothing about this. We did a little digging for her in our archives, and the Rhinebeck Historical Society also helped us track down what they had, which was pretty little. But it wasn't until Dr. Lewinson came to visit us in Red Hook and described her current research that this fascinating story of early public health care in Red Hook and Rhinebeck began to take shape. So we are very grateful to her for coming to share the results of her research with us today, and I'm sure you'll enjoy listening to this untold story. So.
I want to thank everybody. I'm really delighted to be here. Claudine and Christopher I met them, and Patsy, I don't know if Patsy's here today.
She's in
from
Florida.
At least it's warm. And of course meeting David Miller and some of the other people. I want to thank Historic Red Hook, Rhinebeck, the Rhinebeck Historical Society, Northern Dutchess Hospital, and of course the Thompson Trust for inviting me to share my work today and meeting all these wonderful people. And especially the first person that was ever born in this hospital in 1930. I don't have your name, but it's a pleasure to meet you. And I'd like to share my journey and how I got to Red Hook, the discovery of the Red Hook Nursing Association, an association that brought public health nursing into the town of Red Hook by 1916. Someone asked me earlier when I started if I was going to be talking about the 1950s or 60s, and in fact we go back much further. This has been an incredible journey in this Dutchess County to really bring healthcare to this county early on. At that time, community leaders, two of whom I will be speaking about today, sought affiliation with the American Red Cross's efforts to provide rural communities, especially during peacetime, access to health care. It's a story that explores the intersection of community activism, public health, philanthropy, a nascent nursing profession, and national interests. It's a story that resonates with many of us who care about the community in which we live, and in the context in which shapes a broad primary health care response to the needs of that community right now, today. Our doctors cannot be our nurses, wrote Margaret Chanler Aldrich in her letter to the Tivoli Times on April 6, 1916. Aldrich implored her neighbors to join in a community-wide effort to start a public health nursing association. She, along with others in the community, like Mary Gerard Lewis, organized this effort to affiliate with the American Red Cross's new venture called the Town and Country Nursing Service. And this is a photograph of the Town and Country Nursing Service that was put out by the American Red Cross. The Town and Country, which began in 1912, helped rural communities organize their nursing services. They offered them advice and support about structure, how to hire a trained Red Cross nurse that was educated in rural public health nursing, and how to raise sufficient funds to hire such a nurse. In this presentation, I will be speaking about these two local women, Margaret Chanler Aldrich and Mary Gerard Lewis, and their efforts to organize the Red Hook Nursing Association in 1916. Their work in organizing the town, collaborating with various stakeholders, raising funds, and communicating with national organizations and media outlets resonates for me when studying nursing's historical public health initiatives. Understanding the links between activists at a local level and the nursing profession, I believe, can inform today's primary healthcare efforts that require collaboration, advocacy, and intersectoral relationships. Now, a little bit of background for us here. First of all, I am a public health nurse. I am a nurse and I'm a public health nurse, and I no longer teach that topic. I teach the graduate students now primary health care, and in those courses we talk about public health initiatives and of course history, along with what we're doing in the contemporary times now in terms of care and what the communities need and public health needs. But I go back, the relationship between nursing and the women during the 19th and early 20th century is of interest to me. My own dissertation, completed in 1989 from Teachers College at Columbia University, led me to examine nursing's earlier relationship with women's groups, specifically related to women's suffrage. The earliest struggle of the American Nursing Association's efforts, and that's an organization that formed in 1896, their efforts to establish an Army Nurse Corps found strong allies among the women activists from wealthy and often politically connected backgrounds. These early, and this is Mary Chanler Aldrich, right here, from one of the newspapers extolling her work in the American Red Cross. Let me go on. These early collaborative efforts grew as a result of experiences that many women like Mary Chanler Aldrich had while serving in the Red Cross, specifically in this case as a member of the New York Auxiliary 3. The alliance between the philanthropic women and nursing continued in peacetime as the American Red Cross began an experiment in providing a town and country rural nurse. This rural nursing service, which became the town and country, brought rural nurses into communities around the country. Lillian Wald, and I don't know how many of you have heard of Lillian Wald. She was a public health nurse that started the Henry Street settlement on the Lower East Side of New York. She actually claimed the term public health nurse is credited to her for coining that term, which I mean, she was one of these extraordinary Renaissance women of the late 1800s and early 1900s. And she started the Henry Street settlement on the Lower East Side. She was concerned about the urban communities and how to bring nursing care access to care to those communities. But she was also one of the early founders of this town and country nursing service. She, she went out and she found funding for the town and country, the American Red Cross town and country, from philanthropists like Elizabeth Mills Reed, Mrs. Reed Whitlow, who along with Jacob Schiff donated money to establish this peacetime nursing service. A committee on rural nursing began in December 1911. And this was in Washington. Its members consisted of socially minded activists, philanthropists, including Mabel Boardman, who served as chair, Elizabeth Mills Reed. These are names that go on, or Wicklow Rose, who was an educator and the executive secretary of the Rockefeller Sanitary Commission. And these are names that you'll hear later on, and they had relationships with the people, some of the people that were in this community as well. Nursing leaders like Lillian Wald, Annie Goodrich, physicians, Dr. Schwarzeski from the Public Health Service, all met together to participate in developing rules and regulations for this new American Red Cross town and country. I'm getting to Red Hook, don't worry. We're almost there. It's just the background. It's a long background. And by February 1912, the town and country was just about ready to go. Nursing was the nursing leaders like Wald, Lillian Wald, Annie Goodrich, who started the Yale School of Nursing, and Fanny Clement, who you will be meeting in this presentation, established the standards for rural nursing practice and education. Fanny Clement was appointed the superintendent and used her position to support the communities interested in these new services. Now, I first met Margaret, Chanler, Aldrich, and Mary Gerard while reading a 2-year correspondence between Mary Gerard Lewis, who was the corresponding secretary of Red Hook's Nursing Association Nursing Committee. There's a lot of committees. There's a link. How many of you are on committees, right? There's a link here. I think it could be the same committee. I don't know. The letters were archived at the Adriance Memorial Library in Poughkeepsie, and they only provide one side of the story, where Fanny Clement writes to Lewis. I never found any of the letters Lewis wrote to Clement. So that's why I continued, and I went on to meet people like Claudine and Christopher and Patsy at the historic Red Hook, where I asked about, who these people were. I found newspaper clippings, additional newspaper clippings, and the accounts of the community's efforts to affiliate with the American Red Cross. And a trip to historic Red Hook was just provided some of the other additional local data that I have on Lewis and Chanler Aldrich. Briefly, a description of the town, because I've been using this material, so I'd like to, I hope I have this right. I feel I'm with the authorities here, so if I've missed anything, please feel free to highlight it. I'm sure I've messed up somewhere along the line. In 1915, the town of Red Hook included 2 villages, and this is actually a map that I'm going to talk about the study, the 1950 sickness and health in Dutchess County that was done. It was really quite a study, and this is the map that they used. The town of Red Hook in 1950 included 2 villages, Red Hook and Tivoli, right? And 3 hamlets, Barrytown, Annandale, and Upper Red Hook. Red Hook is located in the northwest part of Dutchess County, and it lies about 85 miles north of the metropolitan New York City area. And I think that also says something about the community and the kind of public health initiatives that were started at that time. Rhinebeck is one of the neighboring villages adjacent to Red Hook. The population in Red Hook was about 3,700 in 1910, and during the early 20th century, the population surrounding Red Hook included large estates, wealthy landowners who owned these large estates along the Hudson River. The estate in this photo, and many of you probably know it, is as Rokeby in Barrytown, where Mary Chanler Aldrich was raised and continued to live after her marriage. Her estate and others like them, usually over 300 to 400 acres, provided a source of income for others living in the community. O'Neill Carr, that lovely book that you shared with me, as well as my colleague, Dr. Kelly from PACE, you shared with me the O'Neill Carr book, wrote that, quote, many of the estate owners followed the tradition of their class in the 19th and early 20th centuries, seeking to improve the lives of their workers and the surrounding community. The rest of Red Hook population and its barns included farmers and tenants of those farms who worked for the land for their livelihood. Others worked in the county's industries that included tobacco, cocoa, violet growing, and seasonal type industries like fishing and apple farming. Red Hook's action to establish a rural nursing service was influenced by this 1915 door-to-door healthcare survey that was funded by the Thompson State Trust and the State Charities Association. This survey was designed to systematically identify the county's healthcare needs, and it was considered to be the first of its kind. This is 1915. It's a remarkable piece. Chanler Aldrich was one of the members of the county committee that used this data to establish the nursing service in Red Hook. Now at this point, I would just like to take a few minutes to introduce the background about Thompson Trust and its influence on rural public health nursing, specifically the Red Hook Nursing Association. Because I found that really interesting. It was I'll tell you why. You'll see I talk a lot about nursing. Thomas Thompson established the trust, as most of you know, in 1899 in honor of his wife to help seamstresses, needlewomen, and shopgirls in the town of Rhinebeck, as well as in Brattleboro in Vermont. By 1903, the fund had opened a facility called the Thompson House, which served as, quote, nursing headquarters and a home for indigent sewing women, unquote. The Thomas Trust was interested in expanding its facility and based its new goals on an earlier report by a Miss McCalmont, a hospital expert, who advocated that a hospital of a small size be established with the understanding that, quote, as the work should be largely educative, as much of nursing as possible to be done in the homes and a minimum in the hospital, unquote. And that was in 1915. McCalmont recommended that a visiting nurse center be established where the nurses spent the morning addressing emergencies and obstetrical cases, and the afternoons where they would visit homes and schools and they would offer community health teaching. Now I want to point out that this slide is taken from Isabel Waters' 1915, I believe, survey of district nursing services and public health service around the country. She worked with Lillian Wald at Henry Street, and Lillian Wald collected data, liked to collect a lot of data. And this you can see here, one of the entries, she has the Thompson House District Nursing, and here she has the date at 1902. The other materials say that 1903. So I'm not sure why there was a discrepancy, but she had written 1902, so whether she's wrong or there's a larger story to it, I don't know. But I think it's an interesting thing to point out, because she certainly is talking about the Thompson House District Nursing, which started here. And also I want to point out that Rhinebeck had a public health nurse working with them since about this 1902, 1903, whereas Red Hook did not have a nurse with them. And I think that's why I'm focused on the Red Hook experience, as well as Red Hook tied its interest or its locating of or hiring of a public health nurse through the American Red Cross Town and Country. When this was established, Thompson House, the American Red Cross Town and Country did not exist. They don't start until 1912. So this was pretty innovative in itself, Thompson, the nursing service. And they were very interested in nursing, what nursing could bring to the community. Now the Thompson Thomas Trust collaborated with the State Charities Aid Association on hospitals to embark on this 1950 door-to-door survey. The survey lasted a year and a half between 1912 and the early part of 1913. Families in 5 districts within Dutchess County, including Rhinebeck, Poughkeepsie, Amenia, and Beacon, were queried about health and illness and the adequacy of care that they received. This door-to-door inquiry was considered to be, like I said, quote, the first systematic attempt to secure direct and detailed information concerning sickness in the home, unquote. And when we talk about large data sets with our students today and evidence-based practice, this was, I think, early on, because they had quite a large group of people that they queried. Nursing services, along with medical care, was examined from the point of what existed, what the community health needs were, and what could be offered by additional community-based healthcare services. Published in 1915, Sickness in Dutchess County, New York, Its Extent, Care, and Prevention. This report highlighted the healthcare needs of these various districts within northern New York State, within New York State County. Our point, though, is that they made, in their report, they also said that these counties represented similar rural communities throughout the United States. Although they pointed out that we were near the metropolitan area, and we had, Rhinebeck and Red Hook had a large population of wealthy people living along the Hudson River. So that was a distinction. So, but otherwise they felt this was very much indicative of what other rural communities looked like in terms of illness. The findings showed that over 1,600 cases of serious illness were found in these 5 districts, and how this caused adults to miss work and children to miss days at school. As a result of illness and an overall cost to the community for loss of services, both adult and children, it was roughly estimated the cost to be $412,000, and we thought that was rather high, but when I went back to look, they were extrapolating for the whole county. And I thought it was interesting that they were looking at what it meant for people who are chronically ill, and what it meant when you had infectious diseases, and what it meant for all kinds of children that missed school, and what the cost was to the county as a whole. Yeah, I was surprised. Based on these findings, it was believed that public health nurses could improve these outcomes. The report noted that of the 1,600 patients whose care had been analyzed in this report, 72% or 1,158 patients could have been cared for adequately in their homes had there been their available medical and nursing services. Now the data from this report was used by community leaders like Margaret, Aldrich. Let me see if I had this other slide. No, it was another slide. I'm sorry. The data from this report was used by community leaders like Margaret, Aldrich, Chanler to convince others of the town for a public health nurse in Red Hook. She wrote in the local newspaper, and here's from the Tivoli Times, and it's a clip. She wrote about the appalling healthcare conditions found published within Dutchess County, the need for each resident to subscribe at least $1 a year to hire a Red Cross nurse. She wrote, quote, "Unless everyone takes part by fighting disease and by keeping an expert on the spot, Dutchess County will lag behind," unquote. She called for nurses to be hired in the community, writing, and I love this quote, so I'm using it twice, "Our doctors cannot be our nurses," unquote. And she hoped for, quote, "an immediate demand for the Red Cross rural nurse." On December 17, 1915, Fanny Clement wrote to Mary Gerard Lewis, acknowledging Gerard's earlier letter that was sent to Jacob Schiff, the philanthropist, and he was the head of the, I think he was the chair of the board of the American Red Cross. Well, Mabel Boardman was, but he was on the board of the American Red Cross. And where she inquired about the new rural public health service called the Town and Country. Schiff forwarded Lewis's request for information to Clement, assuring Lewis that Clement would send both the application and a questionnaire in order to complete the appropriate public health nurse in her town. Clement thanked Lewis for offering her home to the Red Cross to live, as well as, quote, starting what would be a community center or a neighborhood house for the surrounding county, unquote. 1 month later, Clement expands on this idea, writing that now the Red Cross advocates the establishment of, quote, the Red Cross stations, which will merge the development of the health center idea in conjunction with its various activities of the American Red Cross, unquote. Clement suggested that the public health nurse would be housed in the center, as well as a room for first aid work and classes in the home care of the sick. Now, Fanny Clement, and it was very difficult to find a photograph of her, is a 1903 graduate of Smith College and later graduated from the Boston City Hospital School of Nursing. In her role as superintendent of the American Red Cross Town and Country, she transmitted the professional ideas about public health nursing of the time, both the art and the science, to the lay public and to Red Hook in particular. Although little is known about the background of Clement, even less is known about the background of Mary Gerard Lewis. She was, and this, we're not quite sure.
Her name is there, but we don't know which one she is.
Her name is here. We don't know which one. So if anyone knows the name, please feel free. Come on down. But she is in this photograph, and this was, I think, this might have been the 1917 photograph with their canning. They did some volunteer work during World War I. But in any event, she was born in September, and she died May 1932, 2 years after you were born. And she died at the age of 73. According to her death certificate, her occupation was listed as housewife. She was single and had lived in Red Hook for over 45 years. Her parents were Charles Lewis and Harriet Gerard. In 1932, two local papers described Lewis as, quote, the first person in the vicinity to be interested in a nursing association for Red Hook, and credit is due her for Red Hook now having a town nurse in connection with the association, unquote. Her long-time commitment to nursing was seen through her role as secretary of the Red Hook Nursing Committee, as well as her legacy she had hoped to leave nursing. In her will, she had asked that her cousins would let the house that they would inherit from her be used as the home and headquarters for the Red Hook Nursing Association. She also left the bulk of her estate to her 6 friends, including Margaret Chanler Aldrich. Now, it's not clear to me whether her cousins, they were supposedly heirs of the John Lewis branch, actually gave the house to the Red Hook Nursing Association, as few records existed about this organization, as well as few memories. As Claudine said, no one seems to really know much about this Red Hook Nursing Association. Patsy, and this house, oh sorry, let me go back in a second. This is, I found this on the web actually, and I'm not sure, unless you gave it to me.
No.
I think I found this on the web, and it said it was a nurse's headquarters here in Red Hook or in Rhinebeck, but I'm going to go back and look again.
Yeah.
So I put it in because somewhere she has a house that was meant to be the infirmary for or the home for these nurses. In any event, Patsy, one of the volunteers at Historic Red Hook, had researched the lineage of Mary Gerard and located Lewis's tombstone at right here, it was her tombstone. And it was a small flat stone, and she had to clean it off, and she was really rather upset about the fact that this was Mary Gerard Lewis, who had contributed so much to the community, and these are her family with larger tombstones, and she was concerned. And then she found this newspaper clipping that explained that Mary Gerard Lewis was one of the last people in her family to be alive. So we don't know if that might have been, I don't know what happened to the two cousins, because she does have a cousin that I find out about. The newspaper also recalled that she befriended cats, and her house in Annandale was a veritable hospital. So I'm not sure if it was a hospital for the cats, for the Red Hook Nursing Association. It's great to be a historian because I say it was such, I have no clue, but I hope to find out someday. Mary Gerard Lewis, though, did have a cousin, and I found this out subsequently to our visit, Mary Elizabeth Lewis, who became a public health nursing following nurses training at the John Hopkins School of Nursing, and she had graduated in 1916, the same year the Red Hook Nursing Association started. She volunteered in the U.S. Army Nurse Corps during World War I. When she returned, she worked at Red Hook Nursing Association until 1920, when she became, quote, a field representative and supervisor for the American Red Cross in Washington, D.C., unquote. So we know that the Red Hook Nursing Association was here through the 1920s, and my guess and hunch, it may be to the early 30s, and then it changed as another organization was formed. Now, Margaret Chanler Aldrich, she's much better known. And she received national recognition and public acclaim for her volunteer activities with the Red Cross. The account of her sailing off to Ponce, Puerto Rico with Anna, and I apologize, poor Anna, because I will mispronounce her name, Bouliguy, it's French, to establish a hospital for nurses seemed legendary in the newspapers of the time. The account leading up to her receiving a Congressional Gold Medal, that she received a Congressional Gold Medal, which is extraordinary, is as follows, and I quote, "Entire charge of the nursing was soon in their hands. Miss Chanler hired a house for use as a hospital. It was too small, so she hired a larger one, to which she afterward added another. Mrs. Chanler and Bouliguy remained until September 7th, caring for the officers and men, with no assistance except that of untrained soldiers and servants. Trained nurses arrived on September 7th, and the hospitals were turned over to them. Miss Chanler provided means for continuing the rental and running the expenses," unquote. Chanler Aldrich, I learned, spoke Spanish, and she served as an interpreter for the Red Cross in Puerto Rico as she established the hospital there for nurses to practice. She had a long history of supporting the Red Cross, specifically nursing's effort to standardize practice and raise the level of education for that practice. In an email communication with me, Wint Aldrich from Red Hook, I believe, right? Recounts hearing about his grandmother, noting, quote, she was a lifetime resident of the town and had been inspired to take an interest in nursing by her great aunt, Julia Ward Howe, who was active in the Sanitary Commission. You know, we had the Sanitary Commission was engaged in the Red Cross. I mean, it's all very connected, I think, during the Civil War, and she became a vocal opponent of war in the later years of life. As a young woman, Wint continued, Margaret Chanler worked with Clara Barton and operated a field hospital in Puerto Rico, which we learned about, for the Army during the Spanish-American War, and later she helped pass the bill creating the Women's Army Nurse Corps. Chanler Aldrich's interest in healthcare needs of others, whether during war or peacetime, resonated with her work in the local community of Red Hook, as well as her work in New York City, which she refers to in her 1958 memoir, which I was able to obtain. She actively pursued the start of Red Hook's rural nursing initiative, perhaps as a result of her work and proximity or friendship she established with other lay women and professionals when lobbying for the Army Nurse Corps. Chanler Aldrich writes in her memoirs that she was, quote, asked to take on the chairmanship of a nationwide movement to establish an Army Nurse Corps. The appointment on a strictly nonpartisan basis gave me my own footing in Congress from which to work for the measure, unquote. So even before she married, Margaret Chanler's family and friends included a wide array of political figures. This is from her book. These are the photo of some of her siblings, and they were part of the Astor orphans. That's another long story, which I did not include here, so I'm still learning it. But she was quite an interesting person. Her father held a political position in New York. Her eldest brother was elected to Congress. Margaret Chanler moved with him to Washington before she was married, where they entertained congressmen, senators, and notables, including Theodore Roosevelt and their aunt, Julia Ward Howe. Now, Chanler Aldrich's Red Cross experience in Puerto Rico, later in Cuba, Japan, and then in Washington, informed her work in Red Hook. She acknowledged the value of an educated rural public health nurse would bring to the community, and she participated in the collaboration and coalition building efforts to establish this goal. Now, a little bit about the collaboration and coalition building efforts in this town. The citizens of Red Hook recognized that a concerted community effort was needed to bring public health nursing into their community. And on February 11, 1916, the Tivoli Times published an article explaining the plan to start a nursing service and inviting the whole community, like this, to come and attend a planning meeting. The article stressed community support for this venture, stating, if this project is to succeed, the public must cooperate, unquote. The Nursing Association would be responsible for the care for those chronically ill in their community, as well as provide access to health care in the local dispensary. The nursing committee met monthly on every first Tuesday of the month to discuss the plans to establish this Red Hook Nursing Association. Names listed in meeting minutes included men and women for a variety of professions that committed time, energy, and money to support this venture. Margaret Chanler Aldrich, along with other community leaders like Dr. Pritchard, who was identified as the president of that committee, nursing committee, Mr. O.D. Lewis, Reverend J. Parks, and of course Mary Gerard Lewis, served in one capacity or the other. The Red Cross required each town to pay the salary for the rural public nurse they were going to hire. To raise funds, all families in the Red Hook Township would be given, and quote, an opportunity to subscribe to the Red Hook Nursing Association. Families could buy subscriptions, and usually it was $1 or $2, and the records actually show how much people gave. You know, some families gave $2, some gave $1, but then they would have opportunity to have nurses come to visit, that Red Cross nurse would come to visit them. And so it gave them a membership, and it supported the hiring of public health nurses. The town held fundraising events, including bag sales, strawberry festivals, campfire girls, bake sale, undated, and fetes like the one that was held on Rokeby on May 27, 1916, where Margaret Chanler Aldrich raised over $300 at that one fete. It's amazing. Aside from fundraising events, the nursing committee organized town meetings to learn about rural Red Cross nursing service and what nurses could do for their community. At one such meeting, the town and country, the town met a town and country nurse named Esther Harrison, and I don't believe that's who she is, but she would look like her somewhat, who came from nearby Westchester County and purchased the town of Purchase in Westchester County, to speak about the work that she did at the Red Cross. Harrison spoke to the community about her experiences in nursing, and at one point she couldn't come to the meeting earlier that year because there was a flu epidemic and measles outbreak. So she was very busy caring for those kinds of infectious diseases in the community. But when she finally came, she brought with her a movie that the moving pictures to illustrate what public health nurses in rural communities did. And the American Red Cross, this was part of their media campaign. And they would send these videos out, well, not videos, movies, whatever they called them at the time, out to the communities to convince them that they needed to have a rural Red Cross public health nurse in their community. By the fall of 1916, the nursing committee had completed the necessary paperwork to affiliate with the Red Cross and agreed to the Red Cross's stipulation that would assure the hiring of a permanent visiting nurse to this rural community. For example, both salary and housing had to be arranged so as to attract and retain this nurse. Clement informed the committee that they would need to guarantee at least 6 months' salary and at least 3 months had to be deposited in the bank before they could hire this American Red Cross Town and Country nurse. That was part of those regulations that the earlier committee had developed. In addition, a central location for nursing residences was extremely important so that the nurse would be, quote, within easy access to the greatest numbers of families. Aside from location, the nursing committee also had to consider the best kind of transportation the visiting nurse would need that would give her the most access. Clement wrote on April 12, 1916, quote, "Your nurse, I'm sure, will need a horse and buggy to visit her cases, or else a horse. And then it would not make such a big difference as to where she's located," unquote. And that's where I might have not continued as a public health nurse. If I had to get on a horse, that was it. The Red Hook community eventually collected enough funds, and by the fall of 1916, they hired the town and country nurse, Margaret Ruba, as their rural public health nurse. This is, I'll show you a picture of Margaret Ruba in a second. The American Journal of Nursing was published by the American Nurses Association since 1900. And in 1916, and I think this is interesting because I found it here, they show that a township, this was another township that actually started a rural public health nursing service. I think it's interesting to know that Red Hook was really on the map for quite a while in this particular innovative experiment they call, or initiative. And now, Ruba stayed in Red Hook for 1 year. Let me show you who Margaret Ruba. This is Margaret Ruba, and I believe this is Jane Esterna. I can't pronounce her name. Estabrook. I think she's from Rhinebeck. And one of the reasons why they didn't bring Esther Rhinebeck to come to Red Hook to speak, or at least I didn't see records of that. She probably did. The American Red Cross, Fanny Clemens, said in another letter that she knew of her and she thought she was wonderful, but she was not what the rural Red Cross town and country nurse had not gone through the same kind of training and background where they needed to have additional postgraduate education past the 2-year diploma or 3-year diploma program. And when they said postgraduate in those days, it wasn't a degree, it was a 4 to 6 month educational program that Teachers College, Boston District Nursing Service offered, and a couple of other places offered, so that nurses learned how to be a public health nurse as well as a public health nurse in a rural setting, which was particularly unique. So there's Margaret Ruba. And Ruba stayed in Red Hook for 1 year. Within that time, Ruba had made a total of 131 visits and 16 health-related talks to a variety of schools, organizations, and businesses. Public health nurses, a rural public health nurse here, was a school nurse. She visited hospitals, she visited schools, she met all kinds of different organizations to give health-related speeches and talks to the community, as well as take care of the sick in their homes. Ruba's success led to the town to consider hiring an additional rural Red Cross, as well as participate more fully in the Red Cross. The war in Europe by this time had led several healthcare providers, nurses and physicians alike, to leave their communities and serve in the war effort. The necessity for a healthy population became even more apparent as the need for public health nurses at home were needed. Volunteerism in the community continued, as did the work of Mary Gerard Lewis and Margaret Chanler Aldrich. Now, in conclusion, I'm just going to go back here. Margaret Chanler Aldrich and Mary Gerard Lewis's relationship with nursing can be seen within the context of their work in establishing the Red Hook Nursing Association in northern Dutchess County. The town used the findings from the Thompson Trust door-to-door survey, rallied the community to collaborate, raised funds, and affiliated with the Nursing's American Red Cross Town and Country. Now for me, I believe that understanding the history of Red Hook Nursing Association and the relationship with the town and country provides us with important lessons in primary health care as communities today and healthcare professionals, nurses, physicians, and all others, in this case, support each other in achieving its goals. And at this point, I want to thank you, and I probably will welcome all kinds of questions and any input that many of you probably will be able to share with me about the community. So thank you very much.
On 60 Minutes last week or the week before, there was an old RV that was fitted out in rural parts of Virginia, and they were doing this kind of thing even now in 2016. And then some wealthy person gave them a bus, you know, and so they're still going out now.
Yes.
Yes, because those people don't have sanitary conditions, they
Right.
don't have access to medical insurance and all that, so these people go out even today.
Well, I'm glad you brought that up, because one of the things I found, I didn't know if I was making my point, I think hopefully I have, is the relevance to history to what we're doing today. I mean, this is really great stuff. You know, I could sit in an archive and never leave. My husband knows. I love, 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 love this stuff. But it has to be relevant. And so when I speak to the students, and we're talking about public health and primary health care initiatives, and at PACE, we define primary health care initiatives as the broad umbrella where public health fits in, primary care, the one-to-one with patients, you know, those interactions with physicians, nurse practitioners, physicians assistants, however, that one-to-one primary care, then the public health with population-based care all fit under this larger umbrella called primary health care, that really the term grew out of this 1978 World Health Organization's Alma Ata, the Declaration of Alma Ata. I contend, in a lot of my work that I do, that nursing has been doing this, and other professions as well, but I particularly study nursing, has been doing similar kinds of things where they provide access to care, such as in Red Hook. They connect with other people. They collaborate. For example, Margaret, Chanler, Aldrich, married Gerard Lewis. They collaborate with this national organization, the American Red Cross, which really in the United States doesn't really come into its own until that 1905, as what, you know, where they could expand their ideas into peacetime and stuff. And the relevance of what they did to today, to me, is really important. So I appreciate that.
When the nurses, these organizations notice a health issue, like one going on now with mosquito bites, but there's also one she happened to mention, West Virginia, and I was recently reading where DuPont has been poisoning the water systems and so on. There's an outbreak of sickness there with children and whatever. Just the first people that probably would notice something like this would be nurses in terms of on a national level. Do these organizations
Yes.
also move forward towards?
Yeah, I believe that they do. I don't know if we do it enough. I think that one of the problems, and maybe other nurses out there, including my colleague, that nurses very often have participated in political activity. Flint, for example, certainly they're involved. They're lead-level nurses. They're just as involved as the physicians. Sometimes we're not seen, we're not as vocal, or we don't appear to be. But I think that William Wald, for example, back then, and we have nursing leaders now, the American Academy of Nursing, their whole mission is political action and political activity. And as a historian, we link whatever we do to political action and how we can use these arguments for asking for buses to bring access to health care or to clean up water, the environment. We do that in our classes. We do bring that connection. Whether it's as visible as I would like, I'm not sure. You have the American Nurses Association, you have the American Academy of Nurses, you have the National League for Nurses, you have a number of fabulous organizations. And they can't do it alone. They have to collaborate with the larger healthcare all the providers. And that we haven't yet done as good. I saw a hand back there. So.
Could you summarize the question you're answering before you answer it?
That would be a good idea. Sorry. The question was, are nursing organizations today addressing some of the issues that this other lovely woman asked about in West Virginia? They have Now they was on 60 Minutes, and there's a bus that nurses bring rural health care to these communities, looking, I guess, at the environment as well, looking at their home situations, bringing immunizations. You know, I'm thinking of all kinds of health care. And I'm saying, yes, nurses have in the past and now are actively advocating for patients. And we feel very strongly that we are the advocates for patients, whether it be in the hospital in the one-to-one or in the public arena. I don't know if we do enough.
What did the training that the Red Cross gave to nurses consist of? Obviously, they had to learn how to operate a horse and buggy.
Oh, yeah.
What was the content that made them different from other kinds of nurses?
The question, if anyone hasn't heard, is that what was the training, the additional training that Red Cross rural nurses needed in order to go out into these communities? Because they went to coal mines, they went out to the west, they were down in the south, they were here in Red Hook. And when you were a rural nurse, there were long distances to travel, right? I mean, so it was difficult. There was, in the cities, you had more of the health departments and structures, although Dutchess County had one. So what they felt was, and one of the first curriculums that I actually saw was at Teachers College, and I've done talks on this as well, they learned about sociology. Honestly, they learned sociology, they learned sanitation, because they needed to know about sanitary conditions, epidemiology, kinds of things, how to communicate, because when these rural nurses would come into a town, where the town would be asking for them, they had to work whoever was in that town. So it could have been a school board that went through this affiliation process, or it could have been a religious organization, or it could be physicians might have, or just in this town, the philanthropists, the women, the activists wanted to come together, and so the nurses that came and were hired as a Red Cross rural nursing service person. And this was a distinction. They needed the training or education that these sociology courses, communication courses, classes in sanitation, how to care for people. And the training then, in 1916, in the United States, nurses are first educated in the Nightingale Influence Training Schools in 1873, when Bellevue Training School for Nursing opens in New York. And Boston Hospital was the second, and Connecticut Training School for Nurses was the third. In 1873, that same year, there were Nightingale Influence Training Schools. It was mostly an apprenticeship model in a hospital-based kind of program. Nurses worked 12 hours, 15 hours. They were the employees, basically, of the hospital. When the student finished their training in a hospital, they would graduate. The hospital would not typically hire them because they would have the next class of students coming. So 1873 is your first training school for nursing that really opens, and that's the beginning of the modern nursing movement. It was influenced by Florence Nightingale. And so she goes, so these schools open for 20 years. They're proliferating in these hospitals all around the country. Depending on the size of the hospital, depending on what kind of cases the hospital had, would depend on the kind of education the student would have, and they basically provided care for the hospital. When they graduated, they would work as a private duty nurse. That was mostly what they worked as, and eventually into this public health movement that was starting in this country in the late 1800s and early 1900s. You see public health itself in this country is part of the progressive era movement. You have settlement houses starting in Jane Addams in Chicago, and Lillian Wall starts the Henry Street settlement on the Lower East Side. Public health offers nurses another avenue of work. But those 2-year or 3-year diploma-based programs did not offer them enough, these early nursing leaders felt, to be a teacher of nursing or an administrator and a public health nurse. So additional programs in 1899 was started at Teachers College, was one of the first programs to provide postgraduate training or education for nurses. And so since 1899, it's eventually morphed into, nurses have baccalaureates, they have masters, and they have doctoral degrees. And now we have the Doctor of Nursing Practice degrees as well. So it has changed. I hope that was a long answer, but did it answer your question? This way I got all my history stuff in. And
The 1915 Public Health Survey, would you draw a direct parallel to the major diseases and problems of then that we have today here in, for example, Red Hook and Rhinebeck?
Well, I went online to see what the Red Hook, I went to the health department, and I wanted to get a sense of what were some of the issues here, and maybe you can share with me. I couldn't get a handle on what the exact issues are today, but I know, for example, I know that drugs and alcoholism is a concern in rural communities in general. And that was one of the categories that they found there was problems in Red Hook, in Dutchess County. So there's influenza, which is still around. We want people to have immunizations against influenza. Measles now is becoming an issue. There was, of course, measles at the time, diphtheria, which I don't think we have. Chronic illnesses, there's still chronic illnesses. And so my next part of my research I'm doing somewhere else is I'm going to look much more closely at that 1915 survey, because I thought it was fascinating. They also talked about how many nurses, I didn't, when I sent this I hadn't put the slide on that, but there was they felt Dutchess County needed at least 35 public health nurses. They also broke down how many hospital nurses they needed in the Thompson Trust, the Thompson District Nursing House. And they also looked at how many physicians, how many unskilled workers in the home to bring care to the people at home. Nurses' aides, which we call today nurses' aides. So I think there are a lot of parallels. I haven't done enough work on it. And if anyone's interested, you can download it on Google. It's, I can't remember the exact, I will get it for you if you're interested, that you can actually click on it and download free that whole report. I don't know, has anyone ever heard of that report in Dutchess County? I mean,
The 1915 report?
yeah.
Only when you brought it to our attention, it shot it out of me.
I think it's really amazing. And they had earlier reports for this McCallum that they spoke of in that report was a hospital expert. I don't think she was a nurse. So, I just think that there's so many innovative healthcare initiatives that were done here and in general that we seem to have lost those connections. So the relevancy for how do we get communities to go out and start these buses, for example, or these opportunities to bring health education to children or to families. How do we consider that, how much are we losing when we don't take care of our people? And out of the World Health Organization's 1978 Declaration of Alma Ata and the definition of primary health is health for all. And, the elections are coming up. I'm not going to go into that. We'll be here all night. We'd be caucusing right now to Iowa. But the idea that what part of healthcare do we do not want our citizens to have?
Right.
I mean, what part should we say? How many people should get immunized and who shouldn't get immunized? Should it be free or should it not be free? These are conversations that communities around the country should be having. And they were having them in 1912 because they did it then, in 1912 and 1930. There's some research that, some of the motives of these very wealthy philanthropists was so that they could feel assuaged because they were ripping off the public. I had colleagues that I presented different parts of these things, and we always have these interesting historical, discussions. But nevertheless, whatever their motives, and I never found those motives to be the case in Red Hook. When I've read, anything I've read has really been, there's been a real philanthropic interest in the community and the health of people in this community. I think there was a question.
Yes, at this time, at least in urban areas, you see the Catholic Church creating parallel institutions, and they're really concerned about the activism of the progressives, particularly women. But in rural areas, you see evidence of cooperation. In Poughkeepsie, there were nuns that taught in the public school, actually throughout New York State and other areas of the country. And so a lot more attention is paid to the conflict rather than the compromise. And I'm just wondering if you found in your case that religious minorities, were subscribing? Were they supportive of the movement, or how did religious difference and racial difference too factor in?
The question is that what's the difference? that in Poughkeepsie and other rural communities, and tell me if I'm getting this right, there was a religious component or a religious delivery of care, right? The religious orders were very much engaged in the care.
Well, yes, I mean, eventually, so even today, I guess St. Francis just closed, but, you know, local historians, they know, like, oh, well, you know, different groups, they created parallel institutions, so Vassar Hospital and St. Francis, they're so close, but serving different communities. So oftentimes there is there's separation, but in rural communities, they usually don't have the same kinds of resources to pursue separate, you know, programs. At the same time, though, the hierarchy is very critical of the progressive movement and what they perceive kind of as this homogenous group of people who is pursuing, you know, for instance, nursing. So I'm just wondering, was there cooperation? Did they have, you know, did they have the support? Like, you know, I don't know how many, you know, Catholics, for instance, lived in Dutchess County, but would they have used it, or would they not subscribe?
I honestly do not know if they did or not, because I don't have I can't dig into the data enough at this point. But whether they used or not, some of the data from this Dutchess County talks about how many blacks, you know, at the time, and there were very small amounts today also. Some immigrants, because it was an immigrant population, and although this mostly was a German community, there were still other immigrants that must have been here. And it doesn't really speak to that, but I think I have to do more work on it, because that's certainly an important question. Now, Barbara Mann Wall is a nurse historian out of the University of Virginia, actually, and she does work on religious orders. And she looks at the secular versus the religious. And I think that she may have, and I certainly will bring this question to her attention, because I think it's a good question. Who used these services? And I'm still not 100% clear, because the only records I have of this Red Hook Nursing Association is this 1.5-year correspondence, or almost 2-year correspondence, of letters that was sent from Fanny Clement to Gerard Lewis. And I've been to Washington, I've been to the National Library of Medicine, and I know that Red Hook has been acknowledged, and you can see when it started. I wasn't sure when it ended. I think in the 1930s, but it wasn't clear to me there as well. But I'm hoping to uncover more records of this Red Hook Nursing Association. My best guess that it may be in someone's garage or basement or thrown out somewhere, right? I mean, right? Someone kept the minutes and never did anything with it. But thank you.
I'm surprised in your research that you didn't come across the name of Beatrice Cozine. At that time, I guess her name was Tremper, Beatrice Tremper. She was the first administrator of the 1929 hospital, as many people know. But she describes her background as being a community nurse here in Rhinebeck, presumably affiliated with some of the nurses that you're talking about. She graduated, she was a Mount Sinai nurse, and I would guess, based on looking at the dates, that she probably graduated from Mount Sinai in the late 20s. Not too late, because she, as I said, became supervisor of the hospital in 1929. But she was doing community nursing here in Rhinebeck, and it must have been integrating in the program.
Oh, I am sure that she probably was. In other words, that the person, tell me the name again so I can give the name.
Beatrice Cozine.
Beatrice Cozine was a nurse from the first administrators in the 1920s.
She was here for 38 years.
She was here for 38 years, and that she has a background from, she graduated from Mount Sinai. I knew it was one of the, Mount Sinai in New York, and she was a community health nurse.
Prior to becoming
She was a
supervisor.
Tremper.
A Tremper?
Cozine was a Tremper.
Her maiden name.
A maiden name was Tremper.
Tremper. That's an
maiden
old
name
name.
was
That's an old name. Some of them call it Trompor, but Tremper.
Okay. So I haven't looked that far, and I'm wondering, do you have archives here at the hospital then? Do you have archives here at the hospital?
Yeah, it's gotta be someplace.
You know what happens? Sometimes in the, and I have to tell you, I did work on Hunter College, Bellevue School of Nursing, and what I found boxes in the dean's suite, because when she took over, you know, and she was gonna move, she had just boxes and boxes of historical data. Oh, you take it. And half of that stuff, thank God I copied, because most of it was lost in Hurricane Sandy, when they put it in the basement instead of an archive.
All
The pay that was
those
supplied,
men, all those doctors like her.
the pay that was supplied to these nurses, it seemed like a very simple system of payment, like patients would pay ahead a little bit or join.
Into the town, right.
Yeah, and they would get care.
Mhm.
And at the time, there probably wasn't any insurance companies.
Well, there was the Metropolitan Life Insurance Company, and the Town and Country did relate with them. I don't know if that was in Red Hook, where they did capitation, where they actually, people who had Metropolitan Life Insurance, I'm telling you, if you would look at history, I go like this, oh, really, reading this? When I did a history of case management once, I'm like, I can't believe this. There are some historians that look at Metropolitan Life Insurance, and that some of the immigrants especially would pay into the, you know, a plan, and they would get certain services, and that lasted with Lillian Wald and the Henry Street Settlement, as well as the Town and Country and other district nursing services around the country. That lasted till about the 1940s when, well, at least for Lillian Wald's Henry Street Settlement, because they felt that they couldn't rationalize the business head with the philosophy of nursing. Even then, I'm telling you the discussions, Diane Hamilton writes about this, the ideas about nursing, and it's extraordinary. So the pay to subscribe here in this Red Hook community, I don't know if they had the Metropolitan Life Insurance here. I know that they talked about it, I saw it later on. But you would subscribe and would be a member, and then you would get visits. I don't know how many, if that was even a limit, but you would get visits. But what I thought was interesting is that the Red Cross, it was very difficult to attract a New York City nurse or a nurse from an urban environment to come to any rural community. That was a problem in the United States then, and here's the distinction. Now someone asked for a connection there. It's still difficult to find people to work in rural communities providing access to care. So you wanted to attract them with good salaries. They got a 1-month vacation, and the Red Cross would supply with the community, wherever it was, with someone who would cover for that nurse. They wanted to be sure that nurse would stay for 1 year. Margaret stayed in Red Hook for 1 year. And remember, were you with me when we found an article? I think she was in a car and had a car accident, and she decided she really doesn't like living here. She goes somewhere else. She stayed as a Red Cross rural nurse, but she went to another part of the country. There's some really interesting stories here.
Did they do midwifery as well?
The Red Cross had they had these regulations, and the nurse was not to assist in deliveries, except in an emergency, like if there's no one else around, like, go no, is that the same as today? Oh no, I can't do that. But they didn't do midwifery, but other rural communities did. So, like, you have Myra Breckenridge down in Virginia, in West Virginia, right?
Colorado.
No, that was in the South, in the Appalachian. That was Myra Breckenridge, and they really had to go on horseback. I have a little video clip that's archival in nature from her cousin from the 1930s, and they're on horsebacks, and they're holding the nursing bag like this, and they really perform midwifery. I don't believe that they did midwifery here, and I think Thompson Trust they did obstetrical cases right here in Rhinebeck. So there was a connection between them, and I think at some point they must have merged because we saw another article in the 1930s about the Dutchess County, I think, district nursing service, and I think it was out of out of the Northern Dutchess Hospital. But I don't know what happened to that either. It's very difficult. When I looked online to see where your visiting nurse service are now, it comes out of Westchester Nursing Service, because they have Dutchess County and a Putnam County area, so I'm not sure where your visiting nurses come from.
Primarily Poughkeepsie.
Poughkeepsie?
What would in the age of patent medicine, which is when this was, the glory days of patent medicine being the late 19th and early 20th century, when anybody could concoct anything and sell it, what did the nurses provide to patients which was of help or what was a typical disease that they, and what did they do for it?
Mostly, I think I don't know about the medicine that they would provide. They still needed doctor's orders, although they could go in without any doctor's orders, but they did seek physicians, the collaborative relationship with the physician. They were not nurse practitioners, but Arlene Keeling wrote a whole book about nursing privileges and how some nurses at that time did give medications. What the local, and I'm not sure what some of the local things were at the time, but they basically provided nursing care. So if you were sick, you would get bed rest. If you were on bed rest, for example, they would bring you food. They would make sure that you were eating well, that they did take your, I guess they could take temperatures at the time and pulse. They would bathe you if you had fever. They would, whatever the medications were at the time, and I'm not familiar with them to go into that, but whatever it was, they used orders, they improvised, and I think because if you're in rural communities and they cooperated, depending what that family would do, typically would be what they would do. I'm sorry,
You showed a shot of Mary Gerard Walsh's tombstone. I just wonder if it still exists today and where it would be.
Okay, and I thought I read that, but I guess I meant, I cut and cut and cut because I try not to go too long. That tombstone is right here in
St. Paul's, Red Hook. St. Paul.
It's in
the Lutheran
the
Cemetery.
Lutheran Cemetery in St. Paul's. So mostly the members here were Lutheran, I imagine, or from that kind of a background. Let me see where it is. Here it is. And it's still there because Patsy took me there to see it. I mean, and she was really concerned that it had been. She had to clean this whole thing off, so to show it to me.
Yeah.
And she felt, here's a person who did so much for this community, and her name was lost. So I'm hoping to revive it.
I have a feeling that this story is not yet totally told.
No.
There's going to be more research that's going to go on. We're going to find out more from Sandra. So I think we should probably wrap it up and thank her for the work she's done so far and for sharing that with us.
Thank you.